Good afternoon. This April 28th meeting of Senate Finance Committee will come back to order. The chair is going to lay Senate File 2669, Senator Wiklund's Health and Human Services Bill, on the table for a few minutes so we can deal with the Jobs and Economic Development Bill that was referred back to the committee. So Senator Champion, welcome to that side of the table, and we're going to take up Senate File 1832, the Omnibus Jobs Bill.
Mr. Chair, thank you for having me back. I know you missed me and wanted me to come back, so that's why I couldn't help it but return. We have a small change to make. In fact, there'll be two amendments to one is to the labor section of Senate File 1832, which, as you know, was merged with the Jobs Bill. And over the weekend, there was an issue that came to our attention, and we'd like to fix it. And because there is a fiscal implication, we thought it was most responsible path to come back and make the change here rather than forcing through an amendment on the floor. So I'm happy to have Senate fiscal analyst with me, and I'd like to offer the A76 amendment.
Thank you. Senator Champion offers the A76 amendment. And Ms. Burst, do you want to explain it?
Yeah, thank you, Chair Marty, members. My name is Megan Bursch, and I'm the fiscal analyst supporting the Labor Committee. The A76 amendment removes the requirement that DLI, DEED, and DOR complete a biannual misclassification fraud impact analysis and report, and adds permission for them to complete the analysis. The A76 also removes the corresponding DLI Labor Standards Division appropriations of $555,000 in the 26-27 biennium and $320,000 in the 28-29 biennium from the Workforce Development Fund for that work, and increases appropriations for DLI Apprenticeship Division operating by an equivalent amount. So this is ultimately a net zero change within the Department of Labor and Industry and within the Workforce Development Fund.
And Ms. Bursch, this is what came out of the Labor Committee. In effect, the money was in the apprenticeship programs, and you're putting it back there, and then instead of the study, you're just giving them permission to do an analysis. Okay.
Mr. Chairman.
Senator Pappas.
Thank you. I just wanted to check to see if everybody's on board with this, the commissioner's on board with this, and Chair McEwen is. And
Mr. Chair and Senator Pappas, the answer is yes. I only bring things, especially if there's, as they say, peace in the valley. Yes.
Is there further discussion? Senator Draheim.
Thank you. I was just reading, thank you, Chair, and thank you, Senator Champion. Reading the misclassification fraud impact report that was originally in the bill, and it is quite lengthy. And effectively what it did, I think it was every 2 years they had to give a report. And now we're just asking for an analyst, but we really don't say who's going to look at that, who's going to analyze whatever vague report we get. So I think as this moves forward, I think we need to add some more language onto that, because I think this is, I mean, we might have been too far with the original language, but now we're way too weak. So I think an amendment will be coming on the floor. So.
Mr. Chair and Senator Draheim, we will continue to have that conversation. We understand, and Senator McEwen, who is also here, is nodding her head in agreement that we'll continue to have that conversation.
And Senator Draheim, part of the reason it was stripped down is because there was funding for it in the bill earlier, and now putting that money back to the apprenticeship program. So, is there any further discussion on the A76? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. Senator Draheim, I understand you have an amendment as well.
I do.
And
go ahead, Senator Champion.
And Mr. Chair and Senator Draheim, he does have the A77, but what we thought we would do is read it into the record in order to make sure that everyone knows that it's the A77, and we'll make sure that you get a copy of it, but we wanted to read into the record in order to make sure we can continue to move things forward, if that's okay with you, Mr. Chair.
Sure.
So, Chair, I'd like to offer the A77.
Senator Draheim offers the A77, which is being printed right now. Ms. Doyle-Fontaine, do you want to explain the A77?
Yes, Mr. Chair and members, Senator Draheim. To that, the A77 amendment, this would be, add some language about subgrants under the STEM ecosystem rider that's included in the jobs portion of the bill. And I think there's just some clarification that I think what Senator Draheim would like is to provide notification of any subgrants from the STEM ecosystem group to the Commissioner of the Department of Employment and Economic Development prior to issuing any subgrant. And then there's a reporting requirement for any named grantees that's included in the appropriations for the jobs portion, and that information on the subgrants would then need to be added to the reporting for the Minnesota STEM ecosystem. I did send some language to our drafting support specialists in my office, and they are working on that amendment, but I know you all need to move along. So I could either just read what I sent, or you could wait for a few minutes for the amendment to come down. So it's whatever you prefer.
Can I ask, there was an A77 that's posted, is that the same
Yes,
one?
Mr. Chair, the A77 is posted. I don't know if you have copies in your packets,
We got hard
but
copies, but we're printing them out right over here for a minute.
Chair, if I could, the A77 as drafted, we're just modifying it just a little bit to put less requirements from the deed. The whole thing is we should just be informed on who's getting the subgrants. We don't want to make it burdenful for the deed. We just want to know who are they giving money to, and we needed to tweak the language.
So,
well, Mr. Chair, Senator Marty and Senator Draheim. So yes, the language as it is in the A77 would require the Commissioner of Deed to approve the subgrant before it's issued any subgrant. The language I drafted as a proposal would read as follows. I can read it if you would like. Yes. On line 1.2, so this would just be the new language. So it would read, the Minnesota STEM ecosystem must provide notification to the Commissioner prior to issuing any subgrant under this paragraph, period. The Commissioner must add to the report required in Section 4 for the grant a summary of the subgrants awarded by the Minnesota STEM ecosystem, period.
and I believe that's going to be a different number than A77 then?
That's correct, Mr. Chair.
We could, unless anybody has any discussion of that, we can lay it, we're paused until the printed copy of that comes here.
Chairman?
Senator Pappas.
Mr. Chairman, it just seems kind of old-fashioned to have an amendment read out loud and not have printed copies.
And Mr. Chair, I can provide this language to Ms. Stengel to give to the committee administrator to put with the minutes to go to engrossing if you'd like.
Yes.
Senator Pappas, on that, I'm told, and I see somebody in the back of the room who would probably remember those days, that until about 1970, were 4 copies of bills.
It was before my time.
The chair had the only, before mine too. The chair had the only copy in the committee.
Right.
And, you ask the chair what's in the bill. Things have improved in some ways. Senator Murphy.
Thanks, Mr. Chair. In modern times, amendments get posted, so I'm just looking at the amendment language that was posted here, and I'm hoping Senator Draheim, now that I've read this, could just explain one more time the intention of the amendment, please.
Senator Draheim.
Thank you, Chair, and thank you, Senator Champion and Senator Murphy. The STEM program is a really important program, and I'm glad we're able to fund it. The sub-grant part, I thought we should know who, so we give money out to one organization and they feed it to other. We should know who's getting the money. is all the attempt is of this amendment. When it was drafted, it was probably a little stronger than we needed. Working with Senator Champion, the chair, and Deed, we thought that just knowing who's getting the money, so moving forward, we have a better understanding who's utilizing the grants for this good program. That's all it does.
And Mr. Chair and Senator Murphy, I see this as a friendly amendment.
Thank you, Mr. Chair, Senator Champion, and Senator Draheim. As I read through the amendment, that's what I was reading, and I just really appreciated getting it on the record. Thank you.
I sent it to you and Senator Draheim and Elspeth. It's the A79. I just,
So Chair, I don't know if it's appropriate, but I would like to move the oral amendment, the A77, and instruct staff to make technical changes as appropriate.
Senator Draheim, we apparently just got the A79, which we'll print it up, and that should be about 1 minute,
Okay.
2 minutes.
I would remove the A77 and like to offer the A79.
Senator Draheim moves the A79, which is what was read to us a few minutes ago, and we will have that in our hands as soon as possible.
And, Mr. Chair, again, we see it as a friendly amendment, and if there's no need for us to go over it again, that would be great, but I see that they're passing it out now, so let's do it.
Mr. Chairman,
Senator Pappas.
as it's being passed out, we're not all seeing amendments on the floor anymore. We're looking at them online. So I don't think it's so unusual. I know it's coming right now, but I don't think it's so unusual for us to have digital copies of an amendment, not necessarily,
With longer ones.
killing more trees amendments.
I think you're right, but he's now here, so Senator Draheim has moved the A79. Senator Champion is fine with the A79. It's been explained. Does anybody have any questions about A79? If not, Senator Draheim moved the A79 amendment. Is there any discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. Senator Champion.
That's it.
Senator Pratt.
Thank you. Mr. Chair, I was having an amendment drafted up, but I'll start it off as an oral amendment if I could, and maybe we'll get the drafted amendment here in just a moment. But Mr. Chair, since we've got this bill in front of us again, I noticed that in the labor portion of the bill, we have remedies around break time for employees where they are paid, I'm trying to see here, they are paid their regular rate of pay plus an additional amount equal to the liquidated damages. But then again, we add in an additional fine per employee per day of $1,000. It seems to me that paying the employee the extra amount of time would be sufficient. So I would move an oral amendment to strike lines 130.17 through 130.19.
Mr. Chair,
Senator Champion.
this is not my portion, but I can certainly speak on behalf of Senator McEwen here, is that we would ask that there be no changes to her portion of the bill, and I'd ask the committee to not accept the oral amendment.
Okay, further, first, could you reread the oral amendment? Senator Pratt or whoever, page 1.
Thank you, Mr. Chair. It's to strike lines 130.17 through 130.19.
Senator, Mr. Naumann.
Mr. Chair, I presume Senator Pratt would like to incorporate elimination of A on 130.13.
So, Senate Counsel or Mr. Naumann, can you read the?
I'm sorry.
Which
line was that, Mr. Naumann?
130.13, you'd like to eliminate A as well. We could handle it with technical.
Oh,
motion,
yeah.
but
Is there, Sarah McEwen is here if she wants to speak to it, but Senator Champion, you've already said that. Does anybody else have discussion on the oral amendment from Senator Pratt on page line 30, line 17, delete line 17 to 19. And the paragraph A on, the number A on line 13. Is there further discussion on that oral amendment? Senator Draheim.
You know, I support the Pratt oral amendment. I think it's a little harsh per employee per day. So I would support it, and if we're not going to support it, then I would support, you know, maybe after so many instances, et cetera, and not just all of a sudden.
Okay, is there further discussion? Go ahead, Mr. Naumann. Did you? No.
Mr. Chairman.
Senator Pappas.
Mr. Chairman, in Labor Committee, we have a lot of discussions about penalties, and we've been, you know, reassured by Commissioner Blissenbach that these are really only used in very rare occasions. And there's a lot of warning letters that go out and working with employers. And she said in many cases, employers just don't realize that they've made an honest mistake, and that's corrected, and there's no penalty whatsoever. So I think it's important to leave it in the law so it's a tool that can be used, you know, in case there's a serious problem. But just in reality, these are rarely used.
Chair?
Senator Draheim.
Does this apply to legislators?
I don't think that was a question for anyone, and we are actually allowed to take breaks whenever we want. Is there further discussion of the oral amendment of Senator Pratt?
Mr. Chair,
Senator Pratt.
to the oral amendment, let me just reiterate, we're asking employers to provide the regular rate of pay plus basically a penalty amount of liquidated damages back to the employee. It's the employee that should be made whole, not the Department of Labor. And we shouldn't be, I mean, we added a number of new penalties last year, which were, and I don't believe that continuing to treat all employers as if they're bad. 98, 99% of our employers are great employers, and we should be just targeting the few that that thwart the law. When I did the wage theft bill a few years ago, that was the impetus of it, that it should be a de minimis impact on good employers and a significant impact on bad employers. And I think this has the potential of being a very broad-based penalty to people. I mean, when we use the word may, we're giving the commissioner her discretion. And as Senator Pappas said, we may decide to hold off. The commissioner may decide she needs some additional revenue, and she implements the fee. We don't know. And that's the piece that I'm struggling with, and why I want to make sure that we are making the employee whole, because they're truly the one impacted. There is no impact on the Department of Labor, and they shouldn't be profiting from these mistakes.
Ms. Stengel, before we vote, could you restate the oral amendment?
Mr. Chair and members, if you'll just give me a minute, I need to confer with Senator Pratt briefly.
Mr. Chair, council has an additional revision to the oral amendment.
Could Ms. Stengel read the amendment?
Thank you, Mr. Chair. There's another section where there are the same sorts of penalties for meal breaks. So the oral amendment would be on page 130, line 13, delete the paragraph marker A. On page 130, delete line 17 through 19. That was what was originally described by Senator Pratt. And then on page 131, line 3, delete the paragraph marker A. And on page 131, delete lines 7 through 9.
Okay, is that clear to everyone on the amendment? No further discussion. All those in favor say aye. Aye. Opposed, no.
No.
Motion does not prevail. Further discussion on the bill. If not, Senator Champion,
That's it.
move.
I move, Your Honor. I mean, Mr. Chair.
Yes, it's, Senator Champion moves that Senate File 1832 as amended be recommended pass and instruct staff to make technical and conforming changes. Is there a discussion on that motion? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. Senator Champion, you're back to the floor again.
Thank you.
With that, we will take Senate File 2669, Senator Wiklund's bill, off the table and resume where we were several hours ago. Senator Wiklund, did you want to have, are you ready for questions from Mr. Vessel on the spreadsheet, or where did you want to go next?
It's up to you, Chairman.
Okay, well, I will ask if there are any questions about the spreadsheet. And if not, if there's discussion on the bill. Senator Dames.
Thank you, Mr. Chair, and thank you, Senator Wiklund, for bringing this bill forward. Bear with me, I'll have several questions. Most of them will be on the premium subsidy program. But to start with, the managed care organizations are going to be assessed. And so the 2.8% assessment, is that the maximum, or is that the assessment that's going to be used? How's that going to work?
Senator Wiklund.
Mr. Chair, Senator Dames, that assessment is for the bill or the provision that would increase medical assistance rates to Medicare level, and the 2.8 is the maximum. The amendment that was adopted this morning would say up to 2.8%.
I missed that, Senator.
It would say, Mr. Chair, Senator Dames, up to 2.8%.
Thank you. And Mr. Chair, follow up. That assessment's going to go against the health or two health plan companies. So could you give me an idea what all is included in the realm of health plan companies? Is it long-term care? Is it accidental health plans? Just what all does that include as far as the nature of the health coverages that these plans are providing?
Mr. Chair, Senator Dames, are we still talking about the assessment for funding the provision that would increase medical assistance rates for providers and for mental health providers?
Yes.
Okay, that's an assessment on the MCOs, that's the managed care organization, so that is who that assessment is on.
And who all would be considered to be MCOs?
Mr. Chair, Senator Dames, I guess I am looking, I have some notes with me, but I don't have a precise
Mr. Hudal is coming up to help too.
Well, Mr. Chair, let Senate Counsel help me out here.
Go ahead.
Thank you, Mr. Chair. Senator Dames. Health plan companies, which is who's assessed under this, is defined in Chapter 62Q, which is further defined through a cross-reference to Chapter 62A.011. That cross-references to health carrier. So ultimately, it's health carriers as defined under that section. That reads, health carriers means an insurance company licensed under Chapter 60A to offer, sell, or issue a policy of accident and sickness insurance. A nonprofit health service plan corporation operating under Chapter 62C that would typically is thought of as Blue Cross of Minnesota. A health maintenance organization operating under Chapter 62D, Fraternal Benefit Society operating under Chapter 64B, or a joint self-insurance employee health plan operating under Chapter 62H.
Thank you. Mr. Chair, follow-up.
Continue.
And this states that this assessment will be on the aggregate gross revenues of the manufactured, or the managed care organizations. So if you have a company that's domiciled in Minnesota and they sell products that come under those statutes in other states, will they be required to pay this 2.8%? I mean, that's part of their gross revenue. So are you going to be taxing out-of-state sales in order to support this?
Mr. Hudell or Senator?
I don't.
Mr. Chair, Senator Dames, I cannot give you a definitive answer, and I will certainly look into that a little bit further. I do recall from past research that the state does have a section that that states the health plan companies do not apply to out-of-state sales. I just can't recall that section off the top of my head, and I would have to look into that further to get a definitive answer for you.
I would appreciate if you'd look that up, see if they're exempt or not, because that does have a major issue. That is has a major impact.
Chair?
Senator Draheim.
To that point that Senator Deems made, how can we have an accurate fiscal note if we don't know the revenue collected? Maybe Mr. Nauman could help us understand that.
Mr. Nauman.
Mr. Chair and Senator Durham, I apologize. I was working on something for Senator Pratt at the time that you asked the question, so I'm now trying to catch up to where you were going. Could you give me a little bit more information on what you were asking?
Senator Deems asked about taxing companies that do business outside of Minnesota, or the sales for outside of Minnesota, and we don't know if that applies in this situation, and I was wondering why we don't know that if we have a fiscal note, or, you know, this is a finance committee, we're supposed to understand how the financing works. And if we don't know who we're taxing or how much we're taxing, how can it be an accurate financial note?
So, Mr. Chair and Senator Graham, 2 points. I did hear Mr. Hudella say that he wanted to do a little bit more research to make sure that he understood the contours of what Senator Dames was asking. I think that's a separate endeavor that he will be working on. The fiscal note process does require the agencies to read the language, give us an interpretation, and make a whole collection of assumptions about what is in the fiscal note. So I presume the agencies made an accurate assumption about maybe that question centrally. And if I'm speaking out of school, I'm sure somebody will correct me, but I believe that's probably what happened, and that generated the estimates that you have incorporated into the spreadsheet that Mr. Vessel spoke to earlier.
Senator Dames again.
Thank you, Senator Chair, or Mr. Chair. Next, I'd like to go to the fiscal note. I've got some questions on that, on the subsidy program. So it says that in the fiscal note here, it talks about 20% of the gross health insurance premium is a subsidy that would be sent out to, or would be given on the people that are purchasing the insurance. It's my understanding that the health care providers will take that directly off of the charge they have to the consumer. So that if the rate was $1,000, they take the 20% off and charge them $800. Is that correct?
The The 20% is off of the premium, yes.
And it's taken off at the insurance company level in the bill,
Yes.
correct?
Yeah, Mr. Chair, Senator Dames, correct.
So it also says then that later on that the carriers will be paid back that subsidy. And I believe in the earlier fiscal note, I haven't found it in this one, but I believe in the first fiscal note that you had, it was indicating that would be paid back sometime in late September, early October to the carriers. Is that still the timeline that's being looked at?
Mr. Chair, Senator Dames, I believe that's correct. I don't have, yeah, it says the payments are to be made by September 30th for the prior calendar year.
So the subsidies, the assessment to the insurance companies, when will that assessment go out to the insurance companies?
Can you describe again what you're looking for?
Well, the first part we were talking about was the premium subsidy to the people that are being insured. There's also going to be an assessment to the insurance companies under the subsidy part of it. There's going to be an assessment to the insurance companies for that subsidy, correct?
Mr. Chair, Senator Dames, yes, there's an assessment.
When will that subsidy, when will that charge go out to? When will that go to the insurance companies? And what would be the expected date that that would be paid back to the organization?
Mr. Chair, I think that I'm getting confused with what you are looking for. The payments, the Commissioner, Management and Budget would be responsible for making payments to health carriers on behalf of the eligible individuals. Those payments are to be made by September 30th for the prior calendar year. I guess I'm confused. Are you?
Okay. So that's the piece that you just mentioned is the piece I was talking about earlier. Now, also the insurance companies are going to have an annual assessment to the health plan companies. This annual assessment, when will that go out and when will the payment expectation be on that?
Mr. Hudell.
Yeah. I think he's asking about when is it going to be collected? Okay. So the board must. Mr. Chair, Senator Dames, it's on page 582, and the assessment process starts on line 582 point, let's see, let me just go up a little bit. 582.4. So an annual assessment is imposed, and it says by May 31st each year, the Commissioner must notify each health plan company of the company's assessment for the current calendar year, and by June 30th each year, the Commissioner of Commerce must collect assessments from health plan companies to pay for the premium subsidy program. Now, am I getting both sides of what you're looking for?
Yes, that was the information I was asking. Yep, okay. Thank you. So the program, it says MNsure is authorized to temporarily operate the subsidy program with existing resources and available processes through January 1st of 2027. Can you explain how that's going to work? What do you mean by temporarily operate and using existing resources and available processes? Are we saying that they have the resources that they can take this program, take it over, and they don't need any more people? I mean, it says using existing resources and available processes. So if they're going to handle this and get it all ready in fall of 2025, issue the stuff in 2026 and manage it, and they're going to use existing resources, why later on when we get into the fiscal note further, it talks about the FTEs that are going to be needed to sponsor this, and I think it's around 24. My question is, how can they handle it for the first year with existing resources and not continue to handle it with existing resources?
Mr. Chair, Senator Dames, that's because the first year would be implemented through a manual process that is not fully automated and integrated with technology.
So am I hearing this correct, that if we do it through existing resources and available processes and don't use the computer process, it's going to be that much cheaper? Then why would we down the road convert? Why would we not just continue doing it this way?
Mr. Chair, Senator Dames, we wouldn't want to keep doing it that way because it would cause more of a manual burden on the agency. This was intended to get it going at the time that we need it, which is for plan year 2026.
Senator James.
Further down, it talks about a phased implementation approach. Could you tell me how that's going to work for the year of 2026? What's going to be phased in and how is it going to be phased in and what kind of timelines are we looking at to have a smooth transition so that we don't have major problems like we had in 2017 when Obamacare first came out?
Mr. Chair, Senator Dames, I think that it's laid out in the fiscal note. They have to develop a process and forum for coordinating premium subsidy payments with carriers and for the enrollees. And what we're saying is that they will be able to achieve that in time for the 2026 plan year. And then they will work on automating and integrating it more fully so that the ongoing program is not does not require manual processes.
Senator James.
Another question is, we talked a little earlier on the MCOs, and we're using the same language in the bill here when we start talking about the subsidy and the charges, the assessments, and we start talking about the insurance companies. The folks that are going to be assessed, the companies that are going to be assessed, are they going to follow the same, will that statutes you talked about earlier, will that be the same statutes applied to these companies or will they be different?
Mr. Chair, Senator James, are you talking now more about like who is going to be assessed? Is that
Who will be
correct?
assessed to support the subsidy program? It says the health plans. And I'm curious if the health plans is going to be use the same statutes as we did for the managed care organizations, or will these health plans be will they include such as the accidental health plans that provide insurance for the accidental type? Will it be the long-term care? Will it be the assisted living programs? Will it be the regular insurance programs? What programs will be involved in that, if it's the same or not?
Mr. Chair, Senator Dames, I'd like Mr. Hidalgo can clarify that.
Thank you, Mr. Chair. Senator Dames, yes, it would be the same subset of insurance companies, health plan companies, as defined in those statutes.
In the same question, then, I would want to get the same information from you as far as the gross sales, what that's going to actually include, if it's going to be just in-state sales, or if it's going to be with people that are domiciled here, if it's going to include their sales from other states. And earlier you said you would check that, so if you could find that out, I'd appreciate
Mr.
that.
I told you have an answer there.
Thank you, Mr. Chair. And Senator Dames, yes, I was able to do a little legal research while I was up at the table here and did find the statute I was referring to. It states if a health plan company issues or renews health plans in other states, the chapter only applies to those sold to Minnesota residents or to cover a resident of the state unless otherwise specified. So that would just be Minnesota residents.
Thank you. In here, it talks about it says on page 5 of the fiscal note, it says MNsure does not currently have the technology resources to administer the program and assume no systems in support, either the eligibility or enrollment systems of the plan year 26 and 27. In the previous fiscal note, MNsure had stated that they did not have the ability to stand this program up in 2026, and they could only partially stand it up in 2027. And so if they don't have the technology and the ability to do it, how are we going to do that? And how will the Commerce, as I understand now, the Commerce Department's being brought in on this, management and budget's brought in on this, and then MNsure. So how are those three going to put that together and have that eligible when the market opens up, typically sometime in October or November of this year? How are they going to have that eligible and ready to be stood up when MNsure says clearly that they currently can't do that?
Mr. Chair, Senator Dames, it would be similar to, we did do a manual process in 2017, and that was successfully done, implementing a premium subsidy. And we have, since the first fiscal note came out, in consultation with MNsure, the Department of Commerce, and Minnesota Management and Budget, that's where the new process is laid out in the bill. That brings in the role for the Department of Commerce and the role for Minnesota Management and Budget, and all those agencies feel that they could make the payments happen, collect the money and make the payments happen, and also be able to let people know that the 20% subsidy would be available to them when they're signing up for insurance.
Senator Dames.
So on page 6, it talks about MNsure will engage a contractor to develop the effective and efficient process and paperwork for managing the relationships with carriers and communications payment and information for MMB. It's expected, it states in here, it's expected to be completed in time for the 2028 open enrollment. So if we're going to hire an outside contractor to do this job, what is the purpose of hiring 24 FTEs if we're going to have some outside company doing it?
Mr. Chair, Senator Dames, they would be performing other roles. The point is that, and half of those FTEs would be for the call center, so that's a different role than developing technology or however they've defined this, where they've stated that they engage a contractor to develop the process and paperwork. So in 2026, the payments will happen, the discounts will happen. The full integration into the MNsure shopping experience will not be present, but that is what MNsure is saying will be possible once they get the work completed.
Can you tell me, Senator Wiklund, can you tell me, there's been a lot of changes made. When this was in Commerce, there was just kind of a skeleton, and then it came out of your committee, and it, I believe, went to taxes. I don't think it went to judiciary, but now there's a bunch of new changes. So it looks to me like when it gets to the premium subsidy part of it, very little of that has been heard in a committee, and this is kind of the first hearing it's getting.
Mr. Chair, Senator Dames, no, it was heard in my committee.
So you've heard since you brought in MMB, since you brought in the Commerce Department involved in this, you've had a hearing and it was included in that hearing?
Mr. Chair, Senator Dames, yes, the work went on in the background, and then we had new language, and it has been heard in HHS.
And how long ago was that meeting in your committee?
Let's see, I don't remember what date. I think our markup date was, well, the bill was
posted, was it April?
April 9th and 10th.
Yeah, so the bill was posted, I think, April 8th maybe, and then we had a walkthrough of the bill on April 9th, and then we had our hearing, our markup hearing on April 10th.
So am I correct in stating then that this information was put into your omnibus bill and that the pieces of it did not have an actual hearing other than in the omnibus bill when you marked it up? Is that what I'm hearing?
Mr. Chair, Senator Dames, I think like other bills that are included in an omnibus bill, if the authors of that particular segment of the bill feel that additional work has to happen, then that work goes on, and we aren't going to have the language as it was introduced in an omnibus bill if it's not the correct language. And so we continued to work on this bill after it was heard in Health and Human Services and after it was heard in Commerce and Taxes. And so the work has continued, and the latest and best revision is what is included in the Senate, the HHS omnibus bill.
Thank you, Senator Klein. I'm sorry, Senator Wiklund. Sorry about that. Want to switch over to the hospital direct payment program assessments. So those assessments are the hospital is being assessed, and it looks to me like we're expecting the hospitals to, in a sense, make a loan back to us, and then hope that the federal government is going to make a payment.
Mr. Chair, Senator Dames, it's part of a structured federal directed payment program, and so the work to create this program has to be done in such a way that we develop an application, and then that goes to the federal government. We wouldn't implement it until we receive permission from the federal government, because otherwise we wouldn't receive the additional federal dollars. The point of it is that we're able to make this application. If we're successful, then we are able to create a method for us to draw down more federal funding than we are today, which will benefit the hospitals.
And Senator Wiklund, we've done this before, I believe, other times to capture more federal revenue, I believe, right? In other areas, I think.
And Senator Wiklund, will there be language in there so if something happens at the federal level that the hospitals will get reimbursed then back by the state if they do that?
Mr. Chair, Senator Dames, if something is discontinued by the federal government, would the program, would we make sure that, that the hospitals aren't drawing in an assessment and then not getting that extra funding? Is that what you're asking?
Yes.
Yes, there is language in there that would prevent that from happening. And just to note that this particular proposal was brought forward by the hospitals. They've worked out that they are able to create this method of drawing down assessments from the hospitals with the understanding that they will create a better benefit for them in terms of what federal money is coming into our Medicaid program.
Well, thank you, Senator Wiklund, and Mr. Chair. I do have some other questions, but I'll let somebody else ask questions for a while.
Thank you, Senator Dames. Senator Champion.
Thank you, Mr. Chair, and thank you, Senator Wiklund, for all the work that you've done on this bill. I often say that those of you who are in Health and Human Services, you are saints, let me just say, because it's one of those bills and committees that I know the work is important, but I'm so happy that I'm not on the committee. And I mean that in a good way. Okay. Senator Wiklund, I noticed in the bill that you have the optometrist scope of practice with injection capabilities, and it's my understanding that Senate File 1144 that's carried by Senator McQuaid, and it's really, as I mentioned earlier, is around the scope of practice, and I will be clear in saying that section concerns me. I know that historically, we seek to find compromise in bills to avoid provisions being seen as controversial. And I would venture to say that this would probably fall into that category because there's no agreement between the parties, and that's concerning. Sometimes when individuals have to, and organizations or industries have to, talk to each other, traditionally, we try to make sure that they can find some agreement and then add it into our bill. And traditionally, we separate policy and budget bills and allow policy and budget bills that are not deemed controversial. And there's a separation is warranted if the language has nothing to do with the bill. So all that being said is I know that this is a complex area, but I understand that there's a lot of feelings on both sides, and I do think that this area is a place where there needs to be compromise, and compromise always makes everyone a little uncomfortable, but we should never have just one side of the equation getting everything that they want and the other side not. Then that doesn't bode well when we think in terms of having good public policy. So my hope is for you, Senator Wiklund, to continue working with the interested parties to ascertain an agreement or at least some compromise, and I would hope that would be something that you would bring back to us. If not, again, what's represented there, I'm disappointed with the non-agreed upon language being present in the bill, but I hope, again, Senator Wiklund, that you will commit to continue to work on this important issue because I understand that it's important, and I just would hope that you all will continue to work on it.
Thank you, Senator Champion. Senator Wiklund.
Mr. Chair, Senator Champion, thank you for raising the concern. I think that we have had a lot of discussion about the optometry scope of practice over the past 2 sessions. Last year, you'll remember that we did have a scope of practice and health licensing omnibus bill, and we included several provisions that the optometrist had brought forward to change their authority in terms of prescribing authorities. And so those were also brought forward, or I should say that we passed that off the Senate floor. We didn't make any changes to their ability to administer injections. At that time, we passed it off the Senate floor. It went through. We were able to negotiate in conference committee pretty much the same language. But then in the end, that part of the health licensing omnibus didn't go forward. It was left out. And so Senator McQuaid brought back this bill this year. I will say that the optometrists have modified the injecting authority language to a certain extent. I think, in my opinion, I'm not fully comfortable with that modification, and I would like to see more discussion continue about it to make sure that we do have, I don't know if it'll be like great, everybody agreeing that this is the best language, but I think we still have a little more room for discussion about what could make people more comfortable with giving optometrists greater authority to use injections around the eye. They're not asking to do injections in the back of the eye or, some things, so that's, I think, appropriate. But I think we haven't come to a complete agreement about what are appropriate places that they should be able, capabilities that they should be able to do with injections. And so I'm committed to discussing, I've been discussing all along with the optometrists and the ophthalmologists. I'm happy to entertain more language, and I have some additional suggestions from the optometrists that I will continue to discuss. And I hope that we can get to something that is, more of a well-desired compromise or something. I don't know what the right word is, because compromise is aren't always received well by both sides, but I think there's room here, so I will work on it.
Thank you, Senator Wiklund. Thank you, Mr. Chair.
Thank you, Senator Champion. I'm glad you're continuing to look at that. Yeah, it would be helpful if we had more comfort on that. Further discussion, Senator Pratt.
Thank you, Mr. Chair. I'd like to go back to the premium subsidy portion of the bill. And, you know, the fiscal note that I was able to find online was dated March 10th, and I've got this one now in front of me, and I haven't had a ton of time to scan it, dated 4/18, and I know this bill is passed since then, but I'm kind of curious about, because in the fiscal note, I see MNsure as the agency, but Senator Wiklund has said that both Department of Commerce and MMB will be taking a active role in the management of this, but I don't see anything in the fiscal note. Maybe fiscal staff could direct me where I might find that.
Mr. Nauman or Mr. Vest, you want?
Mr. Chair and Senator Pratt, you'll note that the fiscal note that I believe is in your packet, correct?
Yeah, the preliminary?
Is preliminary on the top?
Yeah.
That is, as of yesterday anyhow, the only portion that was in the fiscal note system and available for members to see, where the numbers that are on the spreadsheet for the Department of Commerce and the Department of Management and Budget, where those numbers came from. They are incorrectly attributed to MNsure in what you have there, but the amounts are the correct amounts, if that makes sense. Mr. Chair and Senator Pratt, unfortunately, the other agencies had not, as of yesterday anyhow, completed their portions of the fiscal note. This is the only portion, as I said, that was available to offer any information at all to the committee to see.
Senator Pratt, continue.
Thank you, Mr. Chair. So, Mr. Albrecht, I guess I'm a little confused. The costs were incorrectly assigned to MNsure, but Deed and Commerce haven't completed the fiscal note. So how do we know these are, in fact, the correct amounts?
Mr. Chair and Senator Pratt, if I might just step in here, we typically don't put preliminary fiscal notes in front of the committee. There was a good reason, because some of the narrative that was described in some of the back and forth that Senator Wiklund and Senator Dames had earlier, it was felt like some of that narrative was important to have. Mm-hmm. The typical practice is for us to completely wait until the fiscal note is completely done. As you know, I just think that I can let Mr. Vessel speak to the numbers and which ones are the most viable ones to use. But I think that it was the narrative that we wanted to have in front of the committee for discussion purposes, thinking that that would be helpful, given that the fiscal note has not yet been completed right. in all cases.
Thank you.
Further discussion,
Mr. Chair.
Senator Pratt.
Thank you, Mr. Chair. And then my other question, as I looked at the bill, it talked about, and I apologize if Senator Dames asked this, I was in another conversation. But if I look at the bill, it says that the commissioner, in consultation with the board, the annual assessment is imposed on health plan companies for each calendar year, and that the Commissioner of Commerce must establish the annual assessment for each health plan company. I guess my question is, is there a rate? Is there a cap? Is there any sort of expectation of what that is? Where do I find that in the fiscal note as part of this discussion? Because again, I'm sorry, I haven't had a chance to spend a lot of time on the preliminary fiscal note.
That raises what is needed, which is calculated. Mr. Chair, Senator Pratt, so the fiscal note does indicate how much needs to be collected to be able to support the 20% premium subsidy. And so the assessment would be set up to raise that amount.
Senator Pratt.
Thank you, Mr. Chair. So, Senator Wiklund, there's really no cap on what could be charged on a dollar basis, right? Because it's all based on the gross premium. Am I right?
Mr. Chair, Senator Pratt, so correct. I mean, that's what the language gives the commissioner the responsibility to determine what the assessment should be for the current calendar year.
Senator Pratt.
Thank you, Mr. Chair. And Senator Wiklund, has there been a actuarial study to show that we believe that the assumptions in the spreadsheet are correct?
Mr. Chair, Senator Pratt, we have not had an actuarial study done on this bill. No. That Minter has stated in the last paragraph that, that would be a long-term consideration, that would be important to do that. I think for purposes of implementing the subsidy, we have the information we need to calculate the amounts and determine, what we need to implement it.
Senator Pratt, continue.
Thank you, Mr. Chair. And Senator Wiklund, I'm not prepared with an amendment this afternoon because, again, I've just had a chance to look at this preliminary fiscal note for the first time. Would you be open to looking at taking some money to execute an actuarial plan before this goes into place, or an actuarial study before this goes into place? Because, I remember we did this with the paid family medical leave and found out that the costs and assumptions were about 10% higher than what we had originally anticipated. And I'm afraid that without someone who can do the right analysis, I'm afraid we're going to be missing out on this piece as well.
Senator Wiklund.
Mr. Chair, Senator Pratt, I mean, we're figuring this out based on our experience with reinsurance. So I think we have knowledge of what our spending or what the cost has been for the reinsurance program. The language in the bill simply states that the commissioner must establish the annual assessment in an amount such that the aggregate assessment amount collected equals the amount necessary for the premium subsidy program established. I think I'm open to saying that we need to do further along, we need to do an actuarial study to look at other factors maybe, and but I don't think that's a requirement to get the program started for the plan year 2026.
Senator Pratt.
Thank you, Mr. Chair. Well, Senator Wiklund, I guess I am concerned that we won't hit the 20% reduction because, again, thankfully we had the actuarial study done before the paid family medical leave went into effect, and again we found out we were just on the base level before any changes we were off by 10%. We don't know, right? I mean, we can take our best guess, but the reason we have actuarial studies is to confirm our assumptions. And, I think this would be money well spent for us to make sure that we do, in fact, achieve. I will tell you personally, I prefer the reinsurance plan. I think it's proven effective at keeping rates down. And I don't think we're going to see the benefit from this plan be as effective as reinsurance. But I'd like somebody expert in the actuarial sciences to take a look at this and show us that our assumptions are in fact correct. I mean, we have phenomenal nonpartisan staff. Don't get me wrong, but we've seen from the agencies in the past that they have underestimated the cost on many, many programs that have come back in forecast adjustments later on. And I would hate to see that happen with this.
Continue, Senator.
Thank you, Mr. Chair. And Senator Wiklund, I'd like to talk about the facility fee piece. I had that marked in my spreadsheet. So Senator Wiklund, we are on, I think it's on lines, and I'll let Mr. Albrecht correct me if I'm wrong, line 632 through 634 on the spreadsheet. Is that correct? He doesn't even have to look. He knows it already. Can you tell me where we're getting the, when we have the prohibition on facility fees, what's driving that expenditure? We're spending $376,000 in fiscal 26, $188,000 in fiscal 27, and $368,000 each fiscal year after.
Mr. Chair, Senator Pratt, the costs that are on our spreadsheet are for the Department of Health to do reporting and so that we can gather the information on what is being charged for facility fees and where, and so it spells out, what needs to be collected. And then in the amendment today, earlier today, it provided more details about, what fields are needed for that data collection process. So that's where the costs come from.
I'm sorry, Senator Wiklund, could you paraphrase that for me? I was
Mr. Chair, Senator Pratt,
aside.
the spreadsheet, the amounts on the spreadsheet are for the Department of Health to perform the data collection and analysis work to understand the facility fees that are being charged in Minnesota.
Mr. Chair. Go ahead. Thank you, Mr. Chair and Senator Wiklund. So as I understand it, when Medicare asked for billing, they asked that the billing be split into two parts, one for the provider and then one for the facility. And that's kind of how we got to some of these facility fees. And I got one of my local hospitals reached out to me over the weekend on this and why it's a big deal, because they run a cancer treatment center. And so then they'll bill the physician piece, and then they bill the facility charge separately, because that's what Medicare instructs them to do. Am I approximately correct on that? On paraphrasing what I thought I heard her say?
Mr. Chair, Senator Pratt, I mean, that's my understanding, that this originated because of the way Medicare has structured billing processes. But what we're doing with this particular ban on facility fees is we are excluding certain types of clinics and certain types of providers, depending on the procedure codes that are used. So, for example, I believe oncology is one of the codes that is then carved out, so that they would be able to charge a facility fee for that particular type of billing code.
Senator Pratt.
Thank you, Mr. Chair. Well, like I say, they operate a cancer treatment center. They do that split. And they are looking at that as a $5 million hit to their income, because they do have to do that split. And I'm wondering how are the hospitals expected to cover the expenses associated with the underlying clinic, the tests, basically, paying for the facility if they have to split out the provider piece.
Mr. Chair, Senator Pratt, I think what the goal is that provider-based clinics are defined, and they are clinics that are not situated in a hospital or right next to it, but they're situated some distance away from it, and that they are charging patients facility fees that don't seem to bear a relationship to being provided a hospital-type service. And so what we're trying to do is clarify, if you are in a hospital or if you're at one of the types of services or you're having one of the services that are carved out of the prohibition, yes, then it makes sense that a facility fee is charged. But if you're a provider-based clinic that is not situated right near a hospital and a patient comes there for a service that is not hospital-related, that maybe that isn't the appropriate place to be charged a facility fee for, hospital facility fee. And so there's reporting and then exclusion of some of those cases where provider-based clinics would be prohibited from charging, billing, or collecting a facility fee for non-emergency services provided at those clinics. And then there's a paragraph that states which codes would be excluded from that prohibition.
Senator Pratt.
Thank you, Mr. Chair. And Senator Wiklund, please excuse my ignorance on this, but what is a provider-based clinic?
A provider-based clinic is defined in the bill on lines 4.25 onward, and it means the site of an off-campus clinic or provider office located at least 250 yards from the main hospital buildings or as determined by CMS. It goes on for a number of other sentences. I don't know if you want me to read the whole definition, but it has a very detailed definition.
Thank you. I missed that part. I apologize.
That's okay.
My concern is if a hospital-based clinic is dependent on these facility fees to operate in the black instead of losing money, and it's owned by a system and that system is now losing money on the clinic, they're likely to close it. So I'm looking at my cancer treatment center. If they're unable to charge these facility fees, they're basically operating in the red. How do we expect those clinics to stay open?
Mr. Chair, Senator Pratt, I think that if there are certain situations, certain clinics, we have, as I mentioned, on lines 5.12 through 5.16, there are exclusions for example, for oncology, obstetrics, wound care, orthopedics, anticoagulation, and solid organ transplant. Those are excluded from being prohibited. The reason that this has become important is that for patients who go to a standalone clinic for a visit it could be just a very short interaction with a provider, and yet they have received a bill that charges this facility fee, and it can be hundreds of dollars, and it really doesn't bear any relationship to what they are doing at the clinic. And so we would like to better understand, why people are being charged, and then how much are they being charged, and then in certain cases it doesn't seem to make sense that should fall to the patient to pay these facility fees. There are times when insurance companies are not paying them, and so the patient bears the responsibility for the full facility fee cost. That doesn't happen for Medicaid and Medicare, and some insurance plans do, cover them. But for some patients, they're finding they get the bill and that facility fee is not covered.
Senator Pratt.
Thank you, Mr. Chair. So you answered my question that I was about to ask, and that is I thought these were covered by insurers, and what I'm hearing is sometimes yes and sometimes no. Do you know if these costs count towards copay, deductible, co-insurance, out-of-pocket limits, anything like that?
Mr. Chair, Senator Pratt, I think it varies by insurance plan.
Senator Pratt.
Thank you. Mr. Chair, I'd like to offer the A61 amendment.
Senator Pratt offers the A60 what?
61 amendment.
61 amendment.
And then I would like to include the amendment to the A62 as an amendment to the amendment.
Senator Pratt offers the A61, and then the A62 is an amendment to the amendment. And they are being distributed right now. These don't quite, it goes into the other, but I'm told one's in amending the bill and the other one's amending the A58 amendment. So we would have to address the two issues separately. Senator Pratt, which one would you like to start with?
I'd like to start with the A61 then, Mr. Chair.
A61 amendment, do you want to explain that now that it's handed out?
Thank you. Mr. Chair, well, this deletes the prohibition on the facility fees and assures that there are cost-sharing requirements. Well, one, that there's required coverage, that all health plans must cover these fees, and two, that any out-of-pocket by the insured goes to their deductible, their copayment, or their co-insurance. There are real costs to these facility fees that are being passed on, and as Senator Wiklund said, they're costs that aren't always picked up in the provider portion of the in the provider portion of the claim, and that's why these like what we're seeing in Shakopee, that will have a $5 million detrimental impact to the financials of the hospital. And my fear is when we're talking about some of our rural hospitals could cause them to close. I don't know if my local hospital could weather a $5 million hit, given the tone of the folks at the hospital. I assume this is going to be a major hit to the type of care that they're able to give. But we also want to make sure that we're not sticking this on Minnesotans without them getting some sort of benefit from it, right? These out-of-pocket costs are real, and I think if a health plan is not covering these facility fees, they should, recognizing that it is part of the overall cost of care and the overall bill. So that is the amendment in short, Mr. Chair, and I request a yes vote.
Senator Wiklund on the amendment.
Mr. Chair, Senator Pratt, so the part of the bill that says coverage of facility fees, it looks like an insurance mandate, and that would apply to people who are insured in the markets that we as a state have responsibility over, which is not all insurance. So we could possibly put this on, excuse me, for, this would be for the individual market and the fully insured market in Minnesota only. So the majority of Minnesotans who have employer-sponsored insurance, we cannot put a mandate like this in place. And so that would not affect the, people who are in those plans. And then I guess I would say, as a mandate, I'm not sure if that would really solve the problem for patients if different plans structure their cost sharing in different ways. They could adjust and, the deductible higher or co-payments or co-insurance amounts so that patients, I don't know, they could end up paying a substantial part of these facility fees if that was determined by their health insurance plan anyway. So I'm not sure if it would really mitigate the problem. And then I'm just wondering, do you know with this, the section that has to do with the repealer, is that just intended to, can you just speak to the intent of that part of the amendment? Thank you.
Senator Pratt.
Mr. Chair, I can take that one.
Okay.
The effect of this is to repeal 62J.824, and the way the system works is you have to delete the whole repealer and reinsert it. So if you looked at the repealer in the bill, you'll see that 62J.824 is now missing. And that's the facility fee disclosure statute.
Inserting everything else, but the 62J was in this.
Okay. All right. Okay. Thank you.
Mr. Chair.
Senator Murphy.
Thanks, Mr. Chair. I don't serve on HHS anymore. So I'm just wondering if Ms. Stengel could just elaborate a little bit on that last part about the disclosure that would be repealed, the meaning of that.
Mr. Chair and Senator Murphy, that's the extent of my knowledge, is the technical way that the system works, but I'm sure I can phone out to my HHS friends who can talk about this.
Thank you.
Thank you, Chair Marty. Senator Murphy, if I heard your question correctly, you were asking what was in that section that would be repealed but now would be reinstated. That language is existing law that discusses disclosure requirements for provider-based clinics. Right now they have to, if they're going to charge a facility fee, they have to provide certain notice or disclosures. That is being repealed in connection with the provisions in this bill because this bill would prohibit such fees.
Thank you.
Further discussion of the A61 amendment.
Mr. Chair.
Senator Pratt.
Since no one else seems to want to weigh in, I guess I'll make the closing comments here, and that is we want to make sure that we have adequate healthcare access across the state. And I am not a big fan of charging extra fees, don't get me wrong, and I certainly don't like mandates. But it seems to me that if we are asking Minnesotans to pay out of pocket, they ought to be able to get some sort of benefit from it. And every insurance plan, whether an employer or individual market, has to be approved by the commissioner and must follow the state rules. So I would think and hope that this covers those plans as well, to make sure that they're getting counted towards their deductible and they're being recognized as an out-of-pocket expense. But making just a blanket repealer of these facility fees without considering the financial impact on the hospitals, I think is somewhat reckless. And I'm not quite sure, I mean, based on the bill in front of us, Senator Wiklund, I'm not sure how the clinics make this, make this up. And what happens if they're forced to operate at a loss? Do they just end up closing the doors and Minnesotans lose have fewer choices and less convenient choices to get care. Maybe, you know, where maybe travel becomes a burden to being able to get the care they need. That's the intent behind this amendment. And I think there just needs to be a lot more discussion before we just undo what's going to impact the hospitals on a projected $1 billion reduction in their revenue. And like I say, $5 billion alone just for the community of Shakopee. So I can imagine what it is when you start popping it around statewide. So, Mr. Chair, I would request a roll call on the amendment.
Senator Pratt requests a roll call.
Mr. Chair.
Senator, who said something?
Mr. Chair, Senator Pratt. I just want to also state that normally when we do see a coverage mandate like this, it goes through the process that we have with the Department of Commerce, the 62J process you may have heard reference to. And basically they put it through an analysis of all the impacts so that we as legislators have an understanding of what we're proposing to say to the insurance plans that it is a mandate for you to do this. I too do not want to cause clinics to go out of business, but I want to have folks recognize that when people talk about healthcare costs increasing, and sometimes it's getting borne by Minnesotans with these fees, and when a hospital chooses to buy the provider clinic and set up this provider-based clinic, part of their reasoning, it appears to me, is that they are able to extend their ability to charge these facility fees. And so some provider or some clinics, you know, they aren't charging facility fees, and these hospital provider-based clinics are, and they're doing the same thing at these locations. So we're trying to get at what are appropriate costs that should be borne by consumers for things that they actually need to cover, and what they're not. I think your amendment, though, it doesn't truly get at the problem, because the cost sharing requirements can be defined in different ways by different insurers, and patients could still be and end up being forced to bear substantial costs for these facility fees.
Senator Friends.
Thank you, Mr. Chair. Thanks, Senator Wiklund. Senator Pratt, I'm a little unclear. The amendment would require 62J review, or the amendment would cause a leapfrogging of 62J?
Senator Pratt.
I'm getting there, Mr. Chair.
And just for context, members, in the Commerce Committee, which Senator Wiklund and Senator Dames and I serve on, we have a lot of talk about if you're going to change costs, where are they going to go? And 62J is one of the processes for additional mandates. And so I'm not for or against the facilities, just more asking, are we going to run this through the 62J process, success or failure there? Or is it your intent, Senator Pratt, that the amendment would mean this particular shift would not need to go through that process at the Department of Commerce? Thank you, Mr. Chair, and thanks, Senator Pratt. Or Senator Wiklund, or anyone else who has a sense of that.
This, if you reinstate the facility fees and require the coverage of them, that coverage would not be going through the process, I presume.
Mr. Chair.
Senator Pratt.
The intent is that it would go through the process.
Any further discussion of the amendment?
Mr. Chair, then I guess I would just ask Senator Wiklund, given that the amendment would make it go through the process, are you treating this as a friendly amendment, or?
Mr. Chair, Senator Friends, no, I don't think that this is helpful, and I don't see any direction that would force this to go through the 62J process. Normally what happens is people bring a bill forward, or they have language that they're interested in seeing pass. And then, Mr. Chair, Senator Pratt, then that would come to the attention of the Health and Human Services Committee Chair and the Commerce Chair. And then we would decide, which of the proposals should move forward through the 62J process. Sometimes we are able to meet all the needs, but sometimes we have more requests than the Department of Commerce can handle. So I don't see anything in the amendment that would force that to happen.
Senator Pratt.
Thank you, Mr. Chair and Senator Wiklund. And it was my intent that it go through the 62J. If there's comfort language that needs to be included in this, I'd be happy to make sure that gets included. Here's my concern, Mr. Chair. We've not defined how clinics are going to make this up. When Medicare is telling them that they have to split the billing, they're also being told that they have to eat the cost that is separate from that. I've not heard a good explanation, and I apologize, I'm not a healthcare expert, so maybe she's explained it to me, and just because of my lack of expertise in this area, I'm not picking up on it. But I can't see how we expect our hospitals to take $1 billion cut in revenue for costs for real costs that they're being asked to incur, and not providing any sort of a workaround for that. So, Mr. Chair, I request a yes vote.
Mr. Chair, Senator Pratt, the bill, there isn't, to force it to go through the process would mean that it cannot be implemented this year, this way. This process is something that takes several months for them to take the requests and then create the evaluations, and then they come back. So there's not, I don't think there's language that can be added that would be comfort language, so I would oppose the amendment.
Mr. Chair.
Senator Pratt.
The point of the first part of the amendment, striking the prohibition, would be to give us the time for it to go through the process.
But then Senator Pratt, aren't you, then you're repealing
I'm repealing the prohibition on facility fees, and then the second part would go through the 62J process. It might not be able to be implemented at the beginning of 2026, but we also wouldn't be cutting $1 billion out of the hospital revenue stream to cover their costs, and then we could figure out.
But then
we're basically, Mr. Chair, we're buying time.
Senator Pratt, it seems to me you're making the patients cover the cost. And because you're getting rid of the repealer of facility fees. So patients are going to have to pay the costs, and until this goes through the process, you don't know if the health plans are going to cover it.
Mr. Chair. Mr. Chair, I would disagree with that. As we heard Senator Wiklund describe, in some cases the costs are being covered, in some cases they're not. What it's doing is it's leaving us at where we are today. There's no additional impact to patients, but it buys us time to get the requirement that health plans cover these facility fees, and that any out-of-pocket cost then goes to help the patient meet their deductibles or copays or whatever the appropriate. I'm sure Senator Dames knows which is which. They all sound about the same to me, but I want to make sure patients get the benefit of it. But why hurt the system? Why make a change today when some of these fees are already being covered by insurance? In fact, I would argue that most are being covered by insurance, and then leaving the status quo is no additional harm. But we are, and we know we're creating harm if we add in the prohibition. So I'm just asking that we keep the status quo in place until the 62J process can be completed.
I guess, Senator Wiklund, go ahead.
Mr. Chair, Senator Pratt, I oppose the amendment because I don't want to remove the sections that would prohibit the facility fees. I think that we have more discussions underway with the Hospital Association about this provision, and I don't think that the estimate that Senator Pratt is stating of $1 billion of loss is accurate. I think we have put in place some carve-outs that will mitigate, what facility fees are being prohibited. And the way to have this coverage mandate become effective would be to bring it forward as a bill or as provided as language and have the Health and Human Services Chair and the Commerce Chair submit it to the Department of Commerce so that it can go through their 62J evaluation process. Just passing this amendment will not force that to happen. So if you want that to happen, then I think that should be something, language brought forward, to the chairs, and then next summer, by August 1st, we have to submit a list to the Department of Commerce on which proposals we want them to evaluate.
Senator Pratt, you keep saying that it doesn't change the situation, which is a real problem to the patients who end up paying it. So you're saying it doesn't change the status quo and it avoids some harm. Well, to me, the status quo is the problem for a lot of patients.
Mr. Chair.
Senator Pratt.
Thank you, Mr. Chair. I don't disagree with you. The question is have we considered all the harms? And instead of just impacting those that do have to pay this out of pocket, we're affecting the whole system and driving losses down to our hospitals. And I'm very concerned about our rural hospitals being able to keep the doors open if we were to do this.
Senator Howe.
Thank you, Mr. Chair. So, Senator Wiklund, if we're not going to allow the insurance companies to have a part of this, so the only thing we're going to do is require so the cost is all going to be borne by the providers. That's what I see. And so is that the outcome then? Is we're going to make sure that the patient doesn't pay it. We're going to make sure that the insurance doesn't pay it. So the people that are going to pay it are the providers. And so the facilities and those clinics that are hanging on by the skin of their teeth are who's going to pay for the cost of providing the care. Is that what I get?
Senator Wiklund.
Mr. Chair, Senator Howe, today, insurance companies have the ability to cover the facility fees, and some of them do at varying amounts. Some of them, maybe they cover all of the facility fees. Some of them are not choosing to cover much at all, and then it falls to the patient to pay it. The bill language and what we amended today does exclude some specific rural hospitals that are critical access hospitals from this prohibition. So they will not be affected by this prohibition on the facility fees. And then also those different categories that I was talking about earlier, wound care, orthopedics, obstetrics, oncology, some of those are carved out from being prohibited from charging the facility fees. So we are trying to mitigate the impact and also, bring it more into balance that hospitals do have to distinguish, what are they charging patients who go to a clinic that's a standalone clinic for a visit that isn't related to the hospital. Should they be charged a facility fee for that visit? That's what we're trying to get at.
Senator Howe.
Thank you, Mr. Chair. Well, I guess the question I have is, so who determined who the winners and losers were and who got exempted and who didn't? Who all had an input in that process? And that's the question I have, is I think that possibly there should have been maybe some more outline on who did that and maybe some more input, because I don't, it appears to me like there wasn't a whole lot of discretion on how that went. Somebody just decided that that's what they wanted, and that's how it came down.
Mr. Chair, Senator Howe, I think the bill author, Senator Uma Verbaeten, has worked hard through many weeks of the session. We had the hearing in my committee quite a few weeks ago. I don't know the exact date, but she also had to have a hearing in the Judiciary Committee, and I'm not sure if there were other committee stops, but all along the process, she has been working very diligently with the Hospital Association and trying to negotiate language that can be acceptable. We understand that there is a possible impact on revenue for hospitals, but we're also saying that there is an impact on Minnesotans and their experience going to clinics that aren't related to hospital visits. So I think the negotiation has been happening. That's why you see additional language in the bill today. We received additional input from the Minnesota Hospital Association on Friday it was after 5 o'clock, and so I haven't had a chance to review and carefully see if that needs to be integrated into our language or not. But that work is going on and has been going on. We very seriously do want something that is helpful to Minnesota patients, but we don't want to remove $1 billion out of the hospital's revenue stream.
So, follow up, Mr. Chair. Thank you, Mr. Chair and Senator Wiklund. I appreciate that you continue to work on it, but when is that committee work going to be done, as this is going to go from here to the floor? That should all be done in committee in the open space, and I don't see that we're going to have a whole lot of time to make that happen in the open space as it heads to the floor. So when is that dialogue and when is that input going to be taken and put into the bill?
Mr. Chair, Senator Howe, I think that is something that is not unusual for Health and Human Services related provisions. We know that these are challenging requests or challenging ideas, and so it isn't simple to just come up with one answer that everybody is happy with. Just as we talked about the optometry provision earlier, it goes through a lot of discussion and back and forth, and we continue to do that. And maybe there will be additional changes as we present the bill on the floor.
Thank you, Mr. Chair. Well, as I understand, by eliminating the fee, we eliminate the ability of insurance companies to pay this fee. And I just looked up the underlying bill, and it never went to the Commerce Committee. I'm just wondering, Senator Dames's lead on the Commerce Committee, would a bill like this that impacts the insurance companies and their ability to pay on certain claims and not certain claims be within the reasonable jurisdiction of the Commerce Committee?
Senator Dames.
Thank you for the question, Senator Pratt. I'd be unable to answer that at this time.
Senator Wiklund, you also serve.
Mr. Chair, Senator Pratt, this particular bill is within the jurisdiction of the Health and Human Services Committee, and not within the Commerce Committee.
Mr. Chair.
Senator Pratt.
Well, thank you, Mr. Chair. Well, it did go to Judiciary and Public Safety. I'm not claiming it wouldn't be within your jurisdiction. I'm just asking if it should have made other stops.
Mr. Chair, Senator Pratt, this particular part of law. 62J is one that is shared between Commerce and Health and Human Services, and it was determined that this particular aspect of this bill is within the part that Health and Human Services takes care of.
Senator Pratt.
Well, thank you, Mr. Chair, and we've had a long discussion on this, and, you know, to your point, yes, there are some people paying this out of pocket. I don't think you can tell me what percentage or how much is being paid out of pocket, how much is being covered by plans today. What we do know is that by doing this, this will be at least $1 billion hit on our local providers. We've talked on many occasions about the concern we have with rural hospitals being able to survive, many of them holding on by the skin of their teeth, and rural clinics to that point. And if they are being forced to split their billing by Medicare, I'm not quite sure how we can say we're going to eliminate this fee and not offset the cost that they're incurring somehow.
Mr. Chair, Senator Pratt, if you're inferring that this will affect their Medicare and Medicaid billing, that is not going to be, that won't happen. If this bill was put in place, it would not affect Medicaid and Medicare billing.
Senator Pratt.
Thank you, Mr. Chair. So, Senator Wiklund, so if that is already coming out of pocket on Medicare and Medicaid, I'm presuming that's what you're suggesting, that they're not covering it.
Mr. Chair, Senator Pratt, no, I'm not saying that patients are experiencing facility fees as if they're on Medicare. They aren't paying. They're covered by Medicare. I'm saying that this facility fee prohibition will not affect these entities' Medicare and Medicaid billing arrangements. They will continue to be able to bill the facility fees to Medicare and Medicaid.
Senator Pratt.
Thank you, Mr. Chair. And again, I'm not a health care expert. Can you show me where in the bill that it would provide that prohibited facility fees can in fact be charged to Medicare?
One place we've added today in the A58 amendment, line 6, we're on 6.20. We have explicit language, interaction with medical assistance. The medical assistance program in Chapter 256B is not required to comply with any provision of this section if compliance with the provision would prevent the state from receiving federal financial participation for medical assistance coverage or result in a lower level of coverage or reduced access to coverage for medical assistance enrollees. And I think that the Medicare part is assumed because of we don't have jurisdiction over Medicare billing, so as a state.
Senator Pratt.
Thank you, Mr. Chair. But Senator Wiklund, this isn't a prohibition on Medicare. This is a prohibition on clinics. How can they charge a fee even to Medicare if they're prohibited from assessing the fee?
Mr. Chair, Senator Pratt, I believe, I don't know if we would need to write that into the bill language, but I guess I could ask that question. Is that something that we need to make explicit? I thought that we did not need to. I'm just looking to council because we talked a little bit about this.
Thank you, Chair Marty. Senator Pratt, to the extent that federal law, which Medicare is clearly governed by federal law, Medicare billing governed by federal law, directly conflicts with state law, the federal law will supersede that. So even in Minnesota prohibits facility fees if that's something that is permissive in the federal government. My understanding is that is not something that the state of Minnesota can touch. So I do not believe that needs to be expressly covered out.
Senator Draheim.
Thank you, Mr. Chair. That sounds very confusing. And You know, when you sit down and look at your statements, especially from our elders, it sounds like we're only going to confuse them more. And I remember years ago I had a bill working on facility fees. I don't like them, but I understand why they're necessary. And, you know, I think when we look at the rural areas, we're losing healthcare facilities every quarter, in my opinion, around the state, or they're closing the majority of the services they're offering. And I'm just really fearful that this is going to do in those facilities. And I get a chuckle out of the 250 yards rule. Obviously, whoever drafted the bill is from the metro and not from outstate. You know, most of my 7-county area, you know, they're driving a half hour to an hour to a medical provider. And we really can't afford to lose any more. And I'm very, very fearful that this is going to be the last nail in the coffin. So I just caution the author as she moves forward with this to remember outstate and not just the metro. Thank you.
Mr. Chair, Senator Draheim, I just want to clarify, Senator Draheim, that the bill does already carve out unaffiliated critical access hospitals from being part of the prohibition on facility fees.
Mr. Chair.
Senator Draheim.
We don't have many left.
So further discussion, I guess I'm still concerned if we keep talking about the surprise medical bills. I just think that's the most devastating thing people face. I think if Senator Pratt can come back next year and get the assessment so the insurance has to cover it, I think it'll help some of the folks. But I think there are a whole lot of the farmers and so on who are in these individual plans, and they're getting the shock bills, and it's just devastating their families. So anyway, any further discussion? It's your amendment, Senator Pratt. Okay. No further discussion. The staff will, a roll call was requested, I believe. Staff will take the roll.
Senator Marty?
No.
Senator Friends?
No.
Senator Pratt?
Yes.
Senator Champion?
No.
Senator Dames? Yes. Senator Draheim?
Yes.
Senator Howe? Aye. Senator Jasinski?
Aye.
Senator Mohammed?
No.
Senator Murphy?
No.
Senator Pappas? Senator Wiklund?
No.
Senator Pappas.
There being 5 ayes and 6 nays, the motion, the A61 amendment is not adopted. And Senator Pratt, you had an A62 amendment.
Mr. Chair, it doesn't make sense to offer the A62 if the A61 didn't pass.
Okay, I'm sorry, I hadn't tried to engross that, so thank you. So the A62 would be withdrawn then. There are further amendments.
Mr. Chair?
Senator Pratt.
Could I ask a quick question? Senator Wiklund, you talk about the exclusion for cancer and a number of other centers. Does that exclusion include all outpatient centers or only those within 250 yards of a hospital? I'm kind of interested from Senator Draheim's question.
Mr. Chair, Senator Pratt, the exclusion is for provider-based clinics that fall into this category of charging CPT codes, and they would be under the definition of provider-based clinic. They'd be located at least 250 yards from the hospital. I mean, that they are outside of that 250 yards. And yet there are certain service-specific prohibitions that are included in the bill.
Thank you, Mr. Chair. Again, not being a healthcare guy, I'm still getting used to these definitions, but what I think I heard was yes.
Is there further discussion on the bill? Senator Draheim, Senator Dames, then Senator Draheim.
Well, thank you, Mr. Chair, and thank you, Senator Wiklund, for your work on this. Going back to the premium subsidy program, I'm having a hard time seeing how we're going to reduce the cost when we're going to charge the people that are reducing the cost to reduce the cost. If you're going to reduce the insurance by 20% and then turn around and charge the people that provide the insurance 20%, I don't see how we're going to save any money. In fact, I think it's going to cost us more money to provide this insurance than it does with reinsurance by quite a margin, because we're going to have third parties involved that don't need to be involved. If you're going to have a premium of $1,000 and you're going to give $200 away, so it's now $800, and then you're going to charge the insurance companies the $200, it's back to a zero. So I think there's a real problem there. The other thing is if we're talking about the rate structure that we're going to pay, and assuming that this bill goes through, then we would be paying, this would be being paid on Medicaid rates, Medicare rates. Is that correct, Senator Wiklund?
Mr. Chair, Senator Dames, can you tell me what, are you talking about the provision to increase the medical assistance rates for provider, physician-based services and mental health?
The provision to increase the medical assistance rate to Medicare rates.
Yes.
If your bill goes through and the subsidy program gets put into place, then the hospitals would be paid Medicare rates. Is that, or the providers, is that correct?
Mr. Chair, Senator Dames, yes, that's the goal of that provision with the MCO assessment, yes.
And thank you, Senator Wiklund. So not only would we have the difference in how the premium is being paid and how the subsidy is being paid, we would also have a difference in how the hospitals would receive funding, because they'd be receiving funding at the Medicare rate versus at the insurance rate. When we take a look at this, there's just a lot of unanswered questions. There's a lot of information that's not known yet. We got a lot of pieces of puzzles. It's a puzzle. We got a lot of pieces laying on the table, but we don't have them all in place. At this point, I would be able to support this bill because of all the unanswered information that we have. And Senator Wiklund, I'm certainly not saying that you didn't do a good job of presenting your bill, because you did. And I'm not saying that you don't understand the process, because I think that you do. But I think that what's happening is we're trying to push this through so fast that we're missing some pieces of the puzzle or don't know for sure where they fit. So I would be unable to support that. And with that said, Mr. Chair, I would move that we table this till we get the information needed that's necessary. And I'd ask for a roll call vote.
Senator Dames asks that we table the bill. Senator Wiklund, any quick comments before we vote on?
Mr. Chair, I think that we do have, we have the pieces in the bill that are necessary for it to move forward. I would not support tabling the bill. We have brought forward reasons for using the premium subsidy to address what reinsurance is addressing today. There are separate reasons for that. The proposal to raise the medical assistance rates is a separate proposal and is desperately needed by providers. And that is where the MCO assessment would take in sufficient funding. They would be getting most of that funding back in higher capitation rates. So there are two separate items. I believe we have all of the fundamental information we need to pass this bill forward today.
On Senator Dames' motion that the bill be tabled, roll call has been requested. No further discussion, although the staff will take the roll.
Senator Marty?
No.
Senator Friends?
No.
Senator Pratt?
Yes.
Senator Champion?
No.
Senator Dames?
Aye.
Senator Draheim?
Yes.
Senator Howe?
Aye.
Senator Jasinski?
Aye.
Senator Mohammed? Senator Murphy?
No.
Senator Pappas?
No.
Senator Wiklund?
No.
Senator Mohammed?
There being 5 ayes and 6 nays on the motion to table, it does not succeed. Senator Draheim had some, earlier I think you had your hand up.
Thank you, Chair, and thank you, Senator Wiklund. I know you probably spent all weekend here working on this, and I do appreciate it. I think we've had a good discussion about a lot of different topics, but one thing I didn't hear is something that I worked on in the past when I was on HHS, and that's transparency. And I know there was a report due for drug transparency in January. Is there anything in this bill that reflects that report?
Mr. Chair, Senator Draheim, I don't believe that there is a specific, if you're talking about like a direct result of a report causing some provision in the bill, I don't believe so. There are provisions in the bill that the Department of Health brought forward that relate to drug price transparency and the information they collect. But that was a health department policy bill that was brought forward.
Chair, thank you. Because I haven't seen that report yet, and I don't know if it's been released or not. It was supposed to be released in January, and last time I looked, I don't believe it was released. So maybe they're holding that back. The other night when Senator Hoffman was in here presenting his bill, we had a little bit of discussion on the METS updates, and just wondering if you had anything to bring the committee up to date from Friday till today on that. Do you remember the discussion? Do I need a recap, or are we?
Mr. Chair, Senator Draheim, I do recall our discussion. I think we were talking about whether certain projects were going to be completed on time. I don't, within my committee this session, we did not have any bills that had to do with specific technology updates for METS. 2 years ago, we did have a large number of systems projects that we funded, and one of them was included METS, and it included certain functionality that they were going to improve. But I did not bring that detailed description of what was to be included in that language at that time with me today. But I can certainly get you, what we requested and what was described in 2023, and then the Department of Human Services does have a responsibility of delivering a report, I believe in September of each year, that outlines, what they have accomplished with each of the systems funding mechanisms that we included in 2023.
Senator Draheim.
Thank you. And we have similar language that I understand is kind of boilerplate that they put in every year for these big bills. In your bill, the same as Hoffman, talking about information technology to upgrade that METS system to pay for that, or to track the paid family medical leave eligibility change that's needed. And just want to remind members that goes live January 1st of 26, and we don't know if this system has been updated. I know the agency said they were going to get back to us. I thought we would have heard something today, but I have not heard or seen anything. That's why I was asking. Just a couple more, Chair, if I could continue.
Go ahead.
Thank you. I know with all the changes that we've pushed onto the counties, they've had real heartburn with the antiquated software that we seem to fund every 8 or 9 years that really never gets improved. And I know, we've funded in the time I've been here. Is there anything in this bill that would help the counties that do most of the work for the state help the processing time for the stuff we ask them to do?
Mr. Chair, Senator Draheim, I think the most specific thing that is meant to address the county's needs for improvement in systems is the $10 million that's been allocated from, currently it's sitting within DHS, and now it's going to be allocated to the Department of Children, Youth, and Families because they have responsibility for the SSIS system. And that combined with the $10 million that we passed last session, so it would be $20 million. And then there's also a federal match that occurs for systems projects. And with that, the Department of Children, Youth, and Families and Minute believe that they will be able to move forward substantially with the parts of SSIS replacement that will greatly improve the lives of the welfare, our child welfare workers in the counties. And they're experiencing, the system has been added, current system has been added to, and now it is very unresponsive. It takes, many minutes for screens to load. I haven't seen it personally, but I've certainly heard in bills in our committee over and over again about how much it impacts the county workers. So I'm pleased that through this bill, we would be able to get the part of that system project going that will directly assist those workers in the counties and hopefully, speed up the time so that they can spend more time with families and children like they are, hoping to do rather than sitting at a computer screen, and not being able to get their work done.
Senator Draheim.
Thank you, Chair, and thank you, Senator Wiklund. And the reason I ask is that, the counties, I have 7 counties, and I've talked to most of them, and they're all telling me between the governor's shifts down to them and what we did with the foster care in the previous bill, it's going to be a 10 to 15% increase across the board, all the counties. So $10 million would be just for me and Senator Jasinski, because we have 10 counties between the two of us, 10 different counties. So it wouldn't go very far. So just want to make sure everybody's aware of that. On the premium subsidy program, the new creation to replace the reinsurance system that I hate the concept of, but I love the outcome of. And I know even Democrats have offered that on the federal level because they thought it was the best program out there. So I think it's funny that we're reinventing the wheel. But the premium subsidy program, is that going to be a taxable program like paid family medical leave?
Mr. Chair, Senator Draheim, we are still in the process of determining whether it would be considered taxable income, and yes, I would hope that it is not, but it's not going to be money that actually comes into the enrollee's possession, but we are still investigating that.
Chair?
Senator Draheim.
Thank you. So, once again, I think we're rolling out a program that obviously it hasn't been ironed out and it isn't ready for prime time, because I assume that there would be FTEs attached if we were collecting and reprogramming for tax collection. Let's see, what else do I have? Just kind of real quick back to the rural hospitals and rural healthcare clinics. Everybody I talk to that works at those facilities is gravely concerned that they are not going to make it another year. And, the staffing shortages, which we hear about all the time, and it's across the state, but it's even harder in rural Minnesota when you don't have the pool of people. And you don't have the volume, so you don't have the option of premium metro rates, if you will. And I'm just very concerned that what we're doing to them is going to end up in closing more. But I know we're out of time and we're supposed to be on the floor, Chair, so I'll leave it at that. Thank you.
Thank you, Senator Draheim.
Mr.
Senator
Chair,
Wiklund.
can I'd just like to make a comment about, we think of reinsurance as being something that's stable and, doesn't have risks maybe. But I would say that, part of the reason that we're bringing the premium subsidy forward is that it does reduce our risk of impact from federal government decisions. We wouldn't need to seek a waiver to make sure we get federal pass-through funding. If you look at our experience with reinsurance over time, we have lost approximately $30 million as a state over these years. And so it has had a negative impact on our finances. There are reasons that I think a premium subsidy program can provide the same effect as reinsurance, and it can be more targeted, and we can ensure that we are not going to be subject to federal decisions that have negatively impacted us. So just wanted to get that out there.
Thank you. And Senator Wiklund moves Senate File 2669 as amended be recommended pass and instruct staff to make technical and conforming changes. On that motion, Senator Pratt.
Thank you, Mr. Chair. Mr. Chair, I just want to say this is a bad bill for Minnesotans. We are increasing assessments on the healthcare system by $6.3 billion over 4 years, and we're raising fees over $70 million in the next 4 years. We are eliminating the ability of hospitals to cover $1 billion in their costs. We're eliminating a very effective reinsurance program that has kept Minnesota premiums among the lowest in the country. And we're passing a bill on a preliminary fiscal note. And Mr. Chair, I don't know that I've ever seen that, and we're still waiting for MMB and Commerce to come back with theirs. I think it's unprecedented that we are doing that in the Minnesota Finance Committee before these two agencies come back. This bill will only raise the cost of health care while reducing access to medical care across the state, Mr. Chair, and I recommend members vote no.
Senator Wiklund, final comments.
Thank you, Mr. Chair. I appreciate the time today and being able to present the bill. I think the bill is a way for us to continue the success and the stability of our public healthcare programs and to move us forward in increasing medical assistance rates, which we have been desperately needing to do in the past and haven't been able to do that. I think it also has valuable proposal that will help fund our hospitals. And I think it has many other aspects that I'm proud of. I really appreciate the work of my staff and all of the team that has to be responsible for Health and Human Services work that we do over the entire session. So my thanks to my staff, and I think it is a good bill, and I think that it's what we need at this time to preserve stability for Minnesotans and also be able to continue some provisions that we know are important. So thank you.
Senator Pratt has requested a roll call. Senator Dames, before we vote. Okay. The roll call has been requested on Senator Wiklund's motion that Senate File 2669 as amended be recommended pass and instructing the staff, etc. Staff will take the roll.
Senator Marty.
Aye.
Senator Frentz.
Yes.
Senator Pratt.
No.
Senator Champion.
Yes.
Senator Dames.
No.
Senator Draheim.
No.
Senator Howe.
No.
Senator Jasinski.
No.
Senator Mohammed.
Yes.
Senator Murphy.
Yes.
Senator Pappas.
Yes.
Senator Wiklund.
Yes.
There being 7 ayes and 5 nays, the motion prevails and Senate File 2669 is amended is on its way. Thank you, Senator Wiklund, and all the staff surrounding you and your staff upstairs as well. Big Bill, this is the last item on the agenda for today, and this committee will reconvene tomorrow morning at 8:30 a.m. I believe we have higher ed and education finance bills on the agenda. With that, this committee is adjourned.